Hello all. We are going to discuss today homeopathic remedy Thuja Occidentalis, and we are referring Allen's keynotes, specifically the PQR32, that says sensation as if body, especially the limbs, were made of glass and would break easily. So now it is my honor to invite our esteemed Professor Dr. V.K. Chauhan, sir, who is going to elaborate on this and giving us the clinical correlation best described under current clinical practice. Over to you, sir.
Thank you, Doctor. Uh, I would like to start from the perspective of revision of materia medica from Allen's keynote. This particular work has been in profession since very long time, and people are still today, they are reading it, benefiting for their day-to-day clinical practice. And even you will find this text is followed for UPSC, PSC, and MD examinations and interviews. So this is a very important work. Here, this remedy, Thuja occidentalis, on the role of keynote and characteristics of Allen's stands on 179 number. Uh, to start with, I must tell you that this book, which we are going to follow, is published by BJN Publishers. And this is the entire text which has been given there. Something about this text, you will realize that this is given in sentences. These sentences are placed in bizarre fashion. There is no rhythm. However, according to Allen, he has picked up the most relevant clinical practical issues which probably he might have faced in his time, but still they are valid today also. The text do not give any gradation. You will find the text is basically taken up from Herring's guiding symptom. And Herring's guiding symptom has got 4 grades. And there are 47 chapters, 47 to 48 chapters are there, which spans this remedy in such a voluminous manner. So it is a very condensed form. And in this condensed form, he has taken up symptoms without bias according to his clinical practical experience. So if you see here, I have highlighted sensation as if body stands in the topography of this drug discussion on the lower end of the discussion of this particular remedy.
Yes, sir.
Now, this Thuja occidentalis, as we have been talking about, there are total 34 sentences are there, or ideas are there, or you can say we tell or we use them or we understand them as peculiar, cure, rare symptoms.
Yes, sir.
So we are, again, I am going to remind, we are concerned with PQR32 means sentence number 32. And if you try to analyze this sentence, it is a characteristic particular symptom. It belongs to particular general
Yes, mind.
and it belongs to extremity section. If you say here
Okay.
it belongs to the limbs are made up of glass, but please remember it is a mental general and it is a delusional symptom. It is a somatic delusion. The body has a perception where it is delusional perception about the body. So friends, let us go and elaborate it. So here it is a lifelike presentation of this particular sensation. Here this pictorial depiction tells you the body, especially the extremities, the hands and the limbs, they appear to be made of glass. And the patient is anxious. He is very much afraid that his limbs are made up of glass and they are going to break if he slightly misses steps or something. So there is an element of fear also and perception of the body as it is made up of glass. So what we are going to do, friends, we are trying to correlate this with modern medical practice. So in modern medicine, it can be best understood through the neuropsychiatric framework. And from neuropsychiatric framework, the core concept is illusion. And what kind of a illusion? Somatic, or it is a body perception distortion. Person feels his body is not anything. This symptom closely resembles somatic type of delusion, and it has got one more component, that the body is extremely fragile. Even a minor movement may
Okay.
cause some sort of injury. And there is a misinterpretation of bodily sensations. Please remember that. The
Mm.
physical body has got no disease. The nerves are intact. There is no diabetic neuropathy. There is not multiple sclerosis, which is a demyelinating disorder of the nervous system. It is not vitamin B12 deficiency. It is not transverse myelitis. It is not Abes dorsalis, which involves the posterior white column and sensory nerve fibers. They give us symptoms because there is a pathology. There is absolutely no pathology. Normal nerve conduction is there. The can go to the brain, and in brain, where it is analyzed, it is misanalyzed. The area of the center of the brain analyzes every sensation, misinterprets. So normal sensations are perceived as dangerous perception of body part. So that is
Mm.
what it is. Therefore, the symptom falls under somatic delusional disorder. If you talk about the psychiatric disorder, we have placing this particular one particular single line symptom is going to give us the idea that it belongs to a psychiatric domain, and the disease which we are going to see is somatic delusional disorder, or broadly speaking,
Delusional
included
disorder.
in delusional disorder. So let us go to the next. Now, this is a very big uh, hypothesis we have about this particular symptom, which is sensation as if the legs are made up of glass, could break easily. So, what is the central idea as we have been talking about? The central idea is somatic delusions.
Delusion.
This is a psychiatric disorder where we
Mm.
have body image distortion is there. This is a
Mm.
central core feature of this particular disease. And if you try to define this particular condition, definition will be it is a subjective abnormal belief or perception. Can be both, in which person feels that his body or the limbs are extremely fragile, like glass, and may break or shatter easily, although no organic abnormality exists in the body.
Sir.
These two things are very, very important for us. And if you try to understand what could be the phenomena, what could be the pathology, so it is a psychiatric problem, so we have to understand, we'll keep it in psychopathological aspect. In psychopathological aspect, you have to remember that in the central nervous system, we are looking at the cerebral hemisphere. In the cerebral hemisphere, you will find there is a frontal lobe, there is
Parietal.
occipital lobe, temporal lobe, and parietal lobe. And between this particular sulcus, lateral sulcus, we have a lobe which is known as insula, insular cortex. So
Mm.
here in the parietal lobe, we have the capacity of ascending tracts, sensory tracts, which ultimately go to the thalamus and relayed in parietal lobe. The body image is generated and we perceive the body image. All sensations are generated here. So a delusional sensation is also perceived here, the parietal lobe. And same time, what happens, insula or insular cortex, what I am going to talk about, is has got a capacity to interpret the things. So it is going to have interpretation of normal processing of body sensations.
Mm-hmm.
Once it is abnormally perceived, this information is sent to frontal lobe. And in the frontal lobe, the prefrontal
Interprets.
cortex, this particular anterior most point, is the area of wisdom, understanding,
Mm-hmm.
and
Judgment. Mm-hmm.
decision making capacities are present here. So, this analysis, which goes to the frontal lobe, perceives that yes, body is fragile. So, this information is transmitted to emotional brain, the limbic system. And once a limbic system comes to know that this body is fragile, there is a reaction, emotional reaction. And that emotional reaction is fear, tension, anxiety that the body is going to get damaged, it is not properly handled. So these three things, perception, interpretation, and understanding, takes place simultaneously.
Mm-hmm.
Now, this mechanism is, you will try to understand here, this mechanism is here, there is a normal bodily sensations which are carried to the cortex, like parietal, but it is misinterpreted here that the body is made up of glass. And then frontal lobe,
Sir,
prefrontal
your
cortex,
voice is cracking, sir. थोड़ा सा voice.
prefrontal cortex,
हाँ.
prefrontal cortex, thought process, decision making process tells us that it's an emotional reaction starts in the limbic system.
Mm-hmm.
Now, if you go deeper into the mind, probably what we can try to understand, what is the psychological meaning is there behind this particular perception. Probably this patient has got their emotional fragility. There is a lot of stress from childhood, before birth, during birth, after birth, early childhood, everything, those particular subconscious stressful situations are carried forward. And this patient becomes vulnerable. There is a deep insecurity in the mind of
Mm-hmm.
being harmed, or there is a projected feeling that body is going to be harmed if it is made up of glass. So there is a core feeling of insecurity, probably, which is giving this origin to this symptom, this particular remedy. Now, if we go to the sign and symptoms, friends, what we find in the physical symptoms, this patient, if moves slowly and carefully, he will preserve his body. And if he avoids pressure, touch, exercise, and crowd, he is much safer. He has got protective attitude towards the body and limbs. And there are complaints of extreme weakness and fragility. So this is a physical component of symptomatology we will find. But same time, the body-mind relationship you will find in the mental emotional sphere is a fixed belief that body or limbs are made of glass. This
Yes.
session of ideas are very, very important. Those are fixed ideas. Intense fear of injury is there, insecurity, there is anxiety, apprehension, which is precipitating from inner insecurities. And then we have hyper awareness of body sensitiveness. And there may have other delusions which are, we can consider them overvalued ideas also. These are the main symptoms, but there may be some other
Other
symptoms may be
dimension.
present in the
Mm.
mental general. Anyway, but if you confront the patient, probably he will come up with this kind of a language. If I walk fast, I may break. My bones are like glass, and even a small touch. These are the core mental features he may come across if he is talking to a physician. Now,
Differential diagnosis.
we need to go for differential also from
Mhm.
psychological point of view. There are very, very important things which comes. The first come is the dominant diagnostics which we have been talking since the beginning is
Somatic delusion.
symptom disorder.
Mhm.
So there is an excessive focus on the body. And then second important condition we have to keep in the back of mind is schizophrenia.
Schizophrenia.
It is a psychotic disorder. And
Mhm.
psychotic disorder is a disorder of thought. That too also very, very important to keep in mind. And then third condition which we have to keep simultaneously is
Depersonal.
derealization disorder. Here there is the core feeling of unreality and
Disconnect.
disconnection with the body.
Mhm.
These two things are very, very important here. Sometimes there can be severe anxiety disorder, health issues which keep on creating a stress in the mind, or there are functional neurological disorders, the conversion disorder, is
Mhm.
known as hysteria. So there are no symptoms in the body, body is perfectly fine, but emotional pain and emotional stress is converted into symptoms. And the last, which we are going to keep in mind and
Organic causes.
eliminate from the investigation point of view, history point of view, examination point of view, eliminate that there is any sign is not present which direct us towards the organic cause. So that is something which is very important from different differential diagnostic point of view. And
Yes.
once we come to the diagnosis, a very important approach we have, detailed psychiatry is much more important for us, not only homeopathic but allopathic point of view. And then
Mhm.
we have mental status examination. Then we have to look for delusional conviction about
What
fragility,
density?
rule out organic disease. We have in psychopathology, there can be certain battery of tests, but most investigations they can be carried out from the clinical point of view, and these are generally include like CBC,
Hmm.
calcium, vitamin D, thyroid profile, blood profile, X-ray, if at all there is patient is present, bone density needs to be
So
taken
your
out.
sound quality, sir.
So quality looks like okay. Let
Can
us
you go to
see.
the computer speaker? No, laptop speaker will not do.
The computer speaker is not working very nice,
Okay,
unfortunately.
okay, okay, okay.
That is the problem.
Mm-hmm.
Anyway,
It is
the
breaking
X-ray
in
is
between.
important
Hmm.
and bone density is important. We
The
have
bone density, okay. Just to, if indicated, if it's a real,
osteoporosis,
if it is a
osteomalacia,
pathological,
vitamin D deficiency.
yes, sir. Yes. If
That
it is
causes sometimes pain,
a,
and pain
the
and suffering
fragility of the
make you
bones.
idea that body is fragile in old age.
Hmm.
That can be one of the components. Both things can
Okay,
remain together.
okay, okay.
I am giving more significance to the psychological or emotional problem or psychiatric problem, but there can be an overlap of certain physical disorders also. There can be
Mm-hmm.
thyroid problem also. Let
Yes, sir.
us not miss anything
Yes, sir.
which is treatable, which is
Hmm.
from the physical point of view.
Hmm. Right,
We
sir.
have neurological evaluation is very important. And psychological assessment is also
Assessment.
important. So, very important diagnostic clue is strong belief of fragility without any objective physical
Physical
component
touch.
or pathology. So, we go to the prognosis. Please remember that it entirely depends upon the early diagnosis and treatment that works every and any disease. Early intervention, better outcome.
Hmm.
Now, let us have the insight into the modern medical intervention planning also. So modern intervention planning has got simply three components. Number one component belongs to psychological. And here, what people are going to do is they are going to go for cognitive behavior therapy. CBT is very, very important. We can also use it in our clinical practice or intervention protocol. That is very, very important. Second important thing is reality testing and cognitive reconstruction. What patient talks about and what patient feels about what is the reality. That
Mm-hmm.
needs to be made understood to the patient gradually, not bluntly, not in one sitting, but you have to go on for such interactions, follow-up interactions, where you will try to give this, give, give him the right kind of a thought process and eliminate the wrong thinking. Well, and then we have psycho education is also there, relaxation and mindfulness. That is one of the therapies we have, and gradual exposure
Express.
to activity. If patient is so afraid that he is not going to go out
Mm-hmm.
to his day-to-day activity, you have to install some sort of confidence and gradually put him back on his daily routine.
Mm-hmm.
Now, here we have to remember third important thing, which is very important, is supportive management. Sorry, pharmac pharmacological management. So they are going to use the drugs which are SSRIs, antipsychotic drugs, short-term anxiety, three components. One,
Mm-hmm.
second is psychotic,
Sir,
third
your voice is not coming
anxiety.
properly. Sir,
Sound is
so
not coming.
sound is breaking, sir. Constantly breaking.
Looks like ये हो ये रहा है कि मेरा जो इंटरनेट है ना वो कनेक्शन स्टेबल नहीं है शायद.
ओके। नहीं सर, आपका स्क्रीन वगैरह बिल्कुल ठीक है।
हाँ, वो कनेक्शन ठीक नहीं है.
ओके, ठीक है सर, ठीक है, कंटिन्यू सर।
Let us see.
यस
The
सर, यस
supportive
यस।
management includes reassurance and empathetic kind of a communication with the patient. And then we have to remember that encourage gradual physical activity,
फिजिकल एक्टिविटी।
and then family education and support is very, very important. Regular
फॉलो अप्स।
follow-up is backbone of treatment.
राइट सर।
Now, take into consideration the key components. Please remember, it is not a physical disorder, but a delusional perception. That is clear in our mind while treating. Second, look for association, associated anxiety. What is the element of anxiety? Mild, moderate, severe. What is the element of depression? Mild, moderate, severe. What are the psychotic symptoms? So, what kind of intensity of symptoms are there? So, accordingly, you will have those particular drugs combination in allopathic system of medicine. And if they are being prescribed, don't suddenly stop it. Try
ओके।
to see that how they are weaned away. If he comes from the allopathic system of medicine, already he is on the right path. So you have to wait and watch and supplement your system, supplement secondary or complement your system of medicine, and see that the treating physician and see his wisdom how he would like to be in the medicine, withdraw the medicine. So have patience. Don't suddenly stop these medicines and rule out organic disorders, maybe it's a multiple sclerosis or some other disease, which is sometimes very difficult to diagnose in initial stage, and treat the mind, assure the patient, and restore his confidence. So these three elements stand together for any system of medicine, whether you are an allopathic physician or a homeopathic physician. This is a backdrop. So we'll go to the now homeopathic approach. How the homeopathic approach is there, So we work on certain principles.
Right.
We treat the person as a whole, mind, body, and generals. We also select the simillimum based on totality of symptoms. We consider miasmatic background, predominantly SORA, psychosis, syphilis. If there are degenerative changes, which can be because of demyelinating disorders, maybe because of degenerative disorder, maybe because of sometimes neurotransmitters, they become more or less. So if we talk
Mm.
to neurotransmitters, they are less or more. So it belongs to psychotic dimension. Degeneration of central nervous system goes to splenic dimensional, and if it is fully functional, it goes predominant sphoric miasmatic state. If the patient belongs to sphoric miasm, the prognosis is very, very good.
Mm.
Psychotic is bad, and symptomatic miasmatic background is there, prognosis becomes poor. So that is the gross miasmatic analysis and prognostic interpretation we have. Now, if you think about indications in homeopathy, delusion, sense of fragility, extreme sensitivity, fear of injury, weakness, lack of confidence, mental disturbances, these are high grade symptoms.
Sir.
Grade 1 components are there. They should be looked into the repertory, and according to their gradation, you should come across to some constitutional medicine. That is the best. Anyway, beside this, we'll see what is the integrated view we can have. If we talk about the modern medicine, it has focus on neurological cognition and symptom mechanism orientation. We want to reduce the symptom intensity. That is the way how they are going to work. Same time, if we are talking about homeopathy, our focus is on physical, mental, physical activity and restoring the balance where the sensation and function is gone wrong. We are going to restore that balance. That is the core feature of homeopathy treatment we have. Now, if at all we have to pinpoint few drugs, the Thuja is the first remedy we have been treating
Mm.
Thuja, and this
Right.
symptom came into this particular remedy. Here we have seen the fixed delusions are there. We have seen that feeling of something foreign in
Organ.
the body or something of being made of glass. Legs are being made of glass and oversensitiveness is there. And we have second medicine, which is Aram Saram Europeum. And this is
Mhm.
extremely nervous sensitivity. There is intolerance to noise, touch, motion. Whole body is too sensitive and wellness. We come to the next drug, that is
Right.
comprehensive. This is having great weakness, exhaustion, fear of movement. Its body cannot bear any stress. And one of the very, very important syphilitic medicine is like Berita carbonica, where the patient has got childish behavior, he is a timid, he is being afraid of being of some harm, feels inadequate, believes body is weak and cannot withstand the stress.
Understand.
So friends, the last thing which we are going to remember is we have who's a glassy body, which tells and interpreted as fragile body, but is the mind sees it and ultimately perceives as body fragility. So this
Mm.
is the core feature which we have. So friends, thank you very much for your kind listening, and I think you have been having great patience to listen to all. I once again pay my gratitude for your patience and for your watching this video. Please remember, sharing is caring.
Thank you so much, sir. Thank you.
Guys, thank